The state government has halved the wait time between doses of the AstraZeneca vaccine to accelerate the vaccination rollout as the Delta outbreak gathers pace across Melbourne. With 176 new locally acquired infections announced today, the push is now on to get 70% of Victorians immunised. The 81,000 jabs administered yesterday bring us to 58.1% of eligible Victorians with a first dose. 36% are fully vaccinated. At that pace, we could reach 70% by the 20th of September, but we're quite a way behind New South Wales, which hit 70% today. Nicole Asher begins our coverage.
This was a place to be in St Kilda this morning, with hundreds lining up for a vaccine. It's hoped those queues will continue, with the wait for a second dose of AstraZeneca cut in half.
So that matches the dosage interval for the Pfizer vaccine.
It's to speed up the rollout, but that's not happening fast enough to stem the tide of infections.
There's not one corner of metropolitan Melbourne that's not touched by this virus.
Among today's cases, there were 61 in Melbourne's west, 67 in Melbourne's north, 22 across the east and south, 13 cases in Shepparton and 1 in Geelong. 3 cases are still being investigated. 17 cases are linked to 4 acquire call centres.
One of these sites is co-located with Healthcare Australia, which does supply support work to our vaccine program.
As cases seed across Melbourne, hospitals are preparing for an influx of patients. The Royal Melbourne Hospital's caring for 11 of the state's 20 COVID cases in ICU. It's now moved into what it calls pandemic mode.
We've got 8 negative pressure rooms in our ICU in normal operation mode, so it's really creating enough capacity for a larger cohort of patients.
The increasing case numbers are a herald of what our health system is going to be faced with in the coming weeks and months.
Following yesterday's minimal concessions, QR codes were attached to playgrounds so under 12s can return tomorrow.
The Premier has 2 options: reconsider or resign. That's how badly the Premier got it wrong yesterday. Victorians cannot go on like this.
Struggling business owners are still reeling after yesterday's pandemic projections.
It looks like businesses might not open till late October, early November, possibly, and that's a very long time to be in lockdown.
While efforts to ramp up the vaccination drive to 70% continue, the Royal Exhibition Building vaccination hub's temporarily closing down to allow for essential heritage works. Appointments have been transferred across the forecourt to the museum. Nicole Asher, ABC News, Melbourne.
Health officials in Shepparton are confident they're getting on top of the outbreak there with 13 new cases and a round of day 13 testing. If they're right, the city may be able to emerge from lockdown later this month. And the Shepparton response is likely to become a blueprint for how to fight a regional outbreak.
It's been a long couple of weeks in isolation for Brendan Bicknell and his family.
Just being stuck inside the house and not having any contact with the outside world whatsoever was a challenge in the first week.
His daughter is a student at Notre Dame College, which was listed as a Tier 1 site last week. The family all tested negative.
Day 13, here we go.
But today, like thousands of other Shepparton residents, they're going to sit in line to get their day 13 tests.
We'll sort of sit there and sit it out, I suppose, and see how long we go for.
When the first cases emerged in Shepparton, the regional city came to a virtual halt.
It had a huge impact. A third of the population, roughly, were in isolation.
It affected the supply of food and made it difficult to provide enough testing and vaccination staff. The state government treated it like a bushfire or flood, sending its emergency management team and calling on the ADF for help.
The Delta variant is changing the landscape for us, even how we respond. So everything is a lesson to be learned.
And the community quickly banded together to find its own solutions.
An organisation called GV Cares, which was just an idea for a Facebook site last Monday, it turned into a huge organisation which delivered food packages to isolated families.
In the last few days, all the cases emerging in Shepparton were in isolation while infectious. And if that continues, the city should come out of lockdown in the next month. That would be a major achievement and a potential blueprint for how to treat future outbreaks in regional centres.
Shepparton as a diverse, multicultural, strong community with strong social links and connections has shown itself to be a bit of a model in how it goes about these things.
I'm pretty positive that the community will be fine.
The Bicknells are confident the wait will be worth it. Courtney Howe, ABC News, Shepparton.
As we mentioned earlier, New South Wales has become the first state to reach the 70% first dose vaccination goal. As a reward, the 1 hour limit on exercise in Sydney's hotspots will be scrapped. Today, the state recorded 1,288 new cases and another 7 deaths. The Premier Gladys Berejiklian says the state must confront what's coming.
The sad reality is, outside of a pandemic, we lose between 600 and 800 people every year to the flu. Accepting that unfortunately people will die, but they will less likely die if everyone is vaccinated.
There are 957 COVID-19 patients in hospitals across the state, with 160 in ICU.